Good morning. Well, I have to start by saying it is very good to be back here with you, and thank you, Wendell, for not making me go through a membership class or something again, because I know I've been gone for a long time. So I also have to thank Wendell for giving me such a non-controversial issue to discuss today. I guess this is maybe kind of what I get for being gone so much lately, but no, but actually I have to say, I think being, that old adage that absence makes the heart grow fonder, being in other churches at times and being away from this church now, sometimes for a couple months at a time, makes me appreciate our church so much more. So I just have to say thank you for that. And I'm actually so glad to go to a church that is willing to tackle tough issues and willing to discuss things that might generate a little bit of controversy even within our own membership. So, but I actually think that that's really good. So, and I want to start out this morning by acknowledging that much like many other topics that we discuss, I know this is a very personal issue for many, many people, and it touches, I think, deep into the core of who we are as human beings. And so I just want to start by acknowledging that and to say that I am very sensitive to that fact. And I hope that what I have to say today will come across as loving and thoughtful and just challenging all of us to hopefully think about this issue, if we've never thought about it before, to really truly think about it for the first time, or if you have, maybe to think of at least one aspect of it in a different way. Of course, as not being married, infertility in and of itself is not something that I have dealt with, but as an OBGYN, I have had many, many patients that I've sat with in the exam room who are dealing with this. I have people very close to me who have struggled with infertility, and because of that, I know that this is a devastating issue for many, many people. It's difficult, I think, a lot of times for people to talk about, and many are desperate for a solution to that struggle of infertility. And so it's certainly understandable that this is something, again, that just touches us at our core, I think. The desire to have a child was placed in us by God, and that is a good desire. And so I don't want anyone to think that I'm saying diminishing the pain and the struggle of infertility in any way. Living with an unfulfilled desire for something that we were made for is deeply painful. And it's completely understandable that we would seek ways to alleviate that suffering, especially when the end is in and of itself a moral good. But what I think needs to be considered is whether or not any and all means to achieve that are good. So that's what we're going to talk about today. I think the evangelical church has not really wrestled with this issue enough, and it's so prevalent right now in our culture and in our cultural discussion that I think it warrants a close look. Many within the church, I think probably perhaps even within our church, have utilized IVF or in vitro fertilization to have children. And so there may be people in this room who were conceived via IVF. So I think it's important to point out that I'm not in any way diminishing the value of children who were conceived via IVF. What I want to do today, though, is walk us through just kind of the basics of what IVF is. And if you already know that, then you can maybe just tune out for a second. But I don't want to assume that anybody knows the basics. How it's currently practiced in this country and at times abused, and the state of policy surrounding it. There are also certainly theological considerations surrounding procreation, which I will not cover, though I'm going to use this as an opportunity to plug that I would love if Wendell or Josh would do that at some point. So nothing I should say should be seen in any way of diminishing the value of any human being, including those who exist as a result of IVF. And as Wendell said, I'll leave time at the end for questions, as I really do hope what I say will generate good discussion within the church. So why choose now to talk about IVF? It's not like this is a new technology. It's been around since the mid to late 70s. Well, I think besides it being something that faithful Christians should actually think very deeply about, it really has been pushed to the forefront of the national discussion after a recent Alabama Supreme Court ruling. And some of you might know about this, but just in case you don't, this Supreme Court case, or state Supreme Court case, stemmed from a wrongful death lawsuit from 3 families against an IVF clinic in Alabama after their stored embryos had been destroyed due to negligence. So basically, they let somebody into the clinic that shouldn't have been there. They removed embryos and then just left them to thaw, and so then they died. The Alabama Supreme Court rightly ruled that extrauterine children were also covered under the wrongful death law. Unborn children are children under the Act without exception based on developmental stage, physical location, or any other ancillary characteristics, Justice J. Mitchell wrote in his opinion. The court in Alabama heavily relied on both the wording of the wrongful death statute and language added to the Alabama Constitution in 2018, stating that Alabama protects the rights of the unborn child. This was a correct ruling on the part of the Supreme Court, and many rightly surmise that this ruling could lead to at least regulation of the IVF industry if human embryos, regardless of their location, were treated as any other child would be treated. And some of you may have heard that immediately after that Supreme Court ruling, there were several IVF clinics throughout Alabama that immediately shut down doing anything, at least for a while, until they could figure out what this was going to mean for them. And this also led to a knee-jerk reaction from many pro-life policymakers and pro-life states to enshrine a right to IVF. So I'm just going to give you one example. Senator Ted Cruz from Texas, many of you probably know who he is. He really has been a staunch and consistent pro-life advocate and is not ashamed or afraid to speak out really strongly in support of life. However, he, along with Senator Britt, who I think was from Alabama, introduced almost immediately following this a bill called the IVF Protection Act. And their official backgrounder that they put out for their bill said these bullet points. Since its development in the 1970s, in vitro fertilization has proven itself to be a safe, effective, and reliable means to achieving pregnancy. IVF has allowed millions of aspiring parents to experience the miracle of childbirth. IVF is a pro-woman and pro-family solution for those struggling to have children. IVF has become a symbol of hope for those aspiring to conceive. It is now estimated that nearly 2% of all live births in the United States are the result of IVF, resulting in tens of thousands of happy, healthy babies being born annually. The use of IVF has strengthened our communities and our nation by promoting generations of children and families that otherwise may not have come to be. If that was all true and was all there was to IVF, then I would be in agreement. But I think, or hopefully, we all realize, regardless of our thoughts about IVF, that it isn't quite that simple. So let's start with the basics and go through some definitions and discuss the process of IVF. So first of all, I think we have to start even before IVF talking about infertility. What does that mean? So the technical definition of infertility is unprotected heterosexual intercourse for at least 1 year or 6 months if the woman is over 35 without achieving pregnancy. Then they would be diagnosed with infertility. It can be male factor, female factor, or both. This is a significant issue for families in our country and across the world and is increasing actually in prevalence. It impacts currently about 10% of our population in some way. So this is a significant issue that we all need to consider and likely all know someone who's been impacted by. I think it's important though to recognize that infertility is not a disease in and of itself. It's actually a symptom of another disease or underlying issue. So anything that we do to treat infertility, if it's not treating the underlying issue, it's actually not treating a disease, if that makes sense. So IVF, or in vitro fertilization, involves the union of egg and sperm outside of the human body, typically in a petri dish, and then transferring a resulting embryo into a woman's uterus a few days later. So it's important to note, again, IVF is not fixing an underlying disease. It's a workaround, and we're going to talk about why that's important a little bit later on. So to accomplish IVF, there's a few steps that are typical. Again, this might vary depending on the clinical situation, but typically a woman will be given a medication that essentially temporarily shuts down her ovaries so that the timing of her cycle can be controlled. So you shut down ovarian function, you shut down the ovaries releasing an egg on their own, and then she is given a medication, typically through an injection, that will stimulate her ovaries to sort of overproduce eggs. So the typical would be that an egg would release typically 1 egg per month or per cycle. But what they do in IVF is give medications that are going to really overstimulate her ovaries so that hopefully they can harvest as many eggs as possible. And depending on how her ovaries respond to the stimulation, typically anywhere from 5 to 15, I've seen as high as 20, again, it's just really variable, eggs will then be able to be retrieved. And then the woman is given progesterone around the time of egg retrieval or shortly after to prepare the lining of her uterus to accept that embryo that eventually is going to be transferred. The eggs are then exposed, however many eggs they decide to use, are then exposed to sperm in a lab dish, and they watch under the microscope for fertilization to occur. I think it's important, we're going to go back now to some of our pro-life apologetics to remember that at that moment of fertilization, at the moment of sperm and egg fusion, a human zygote or a single-celled human embryo is formed. And we have to note that at that moment, and again, the science is very, very clear on this point, a distinct living and whole human being comes into existence. The location of that human being, whether that human being is inside of his or her mother, in a dish in a lab, doesn't matter. For my pro-life apologists out there, this is going back to our SLED acronym, right? That environment doesn't matter. We have a human being. So in the past, when this would happen, they would create maybe as many as 15 to 20 embryos at this stage. Now, typically, they're down to only creating about 5 to 6 embryos. And so when we talk about later this surplus of embryos that we have, that's why, because they used to create many, many embryos to increase chances of success, and now they've reduced that. Also, eggs can be frozen before they're fertilized. So you can do the egg retrieval, and then you can freeze eggs, and then just thaw the eggs when you're ready to perform fertilization. So after fertilization occurs, the embryos are observed for several days. During this time, for most embryos now, they are graded as to their likelihood to survive the transfer process, to be able to implant, and then to be able to survive to a live birth. And this is somewhat subjective, but there are objective criteria that they use looking at different, like the morphology of different parts of the embryo. And they can be graded as either excellent, good, average, or poor. And many physicians who are infertility specialists will recommend only transferring those that are excellent or good, followed by average, and then discarding the quote-unquote poor graded embryos. However, it's really important to remember that the studies that they use to determine what should make embryos fit these criteria were very small studies, which means it's very hard to apply them broadly to know what behavior these embryos are going to have. And even those studies showed that up to 1/3 of those embryos that are graded poor will actually go on to achieve successful pregnancies and go on to a live birth. So we're calling embryos poor, saying that they don't have a chance of making it to a live birth when we know that at least 1/3 of them probably would. Additionally, and this, I was not aware actually that this was happening as frequently as it is, but I called up in preparation for this talk and another talk that I was giving on IVF. I called up one of my attendings from residency who's an infertility specialist and asked him several questions. And he said that now the vast majority of couples who are undergoing IVF will have something called pre-implantation genetic diagnosis performed. And so what this involves is removing a few cells from the embryo at about day 3 to 5 of life and testing those cells for a variety of genetic conditions. But they can also test for many, many other things, such as characteristics like eye color, hair color, gender, things like that. And so then those that are considered genetically undesirable embryos, or those even, and this does happen, of an undesired gender, are then discarded. And then only the ones that are considered desirable are kept. So when I say discarded, I think that's kind of a euphemistic term. That means that their lives are ended. They're simply thrown away, and then they die. So after all of this is done, after the grading is done, after the pre-implantation genetic diagnosis is done, then typically we're left with about 2 to 3 embryos that will be given a chance at life. So on day of life between 5 and 7, an embryo then is transferred into the woman's uterus. Now, thankfully, what's called single embryo transfer, meaning just transferring one embryo at a time, is considered standard, although I think it's important for us to remember that this is not a regulation that is imposed on the IVF industry. This is them regulating themselves, so it relies on the physicians being ethical and following the guidelines that their professional organization has set out for them, but it's not a requirement, so some might transfer more. Under some circumstances, they might transfer 2 at the most. That might be if they have those embryos that are graded poor that they're going to transfer, they might transfer 2 of them, hoping that at least one of them will then implant. If a woman has gone through failed IVF cycles previously with just a single embryo transfer, then they might do a double embryo transfer then at that point. Of course, some unethical physicians, like I said, might transfer more to increase their success rate. Can you guess what else increases, though, if you increase more embryos? You're going to get multiple gestations, right? How many people remember Octomom? The young kids in here are like, what? So many of you might remember she was a woman who had gone through IVF, had embryos frozen, and wanted to transfer and give all of her embryos a chance at life. And so her IVF specialist, I can't remember now, maybe somebody remembers, they might not have transferred 8. I think maybe they transferred 6, and then she had some that underwent twinning, and so she ended up being pregnant with 8 babies. So this is very dangerous for mom to be pregnant with that high order multiple. It's very dangerous for the babies as well. They're at risk for many, many complications. And I have to tell you, this is, and I'm not applying this across the board to all infertility specialists, but there was one that I trained with in my residency who was much more cavalier about how many embryos he would transfer at a time than the other group that we worked with. And I asked him if he was worried about high order multiples and what that would mean for mom and for babies. And he said, oh no, you can just reduce. Like it was not a big deal. And so that is what typically will be recommended for women who end up pregnant with 3 or more babies. So even triplets, it will be recommended to them that they do what's called this is so euphemistic, but a multifetal pregnancy reduction. So they choose which babies are easiest to get to, and they put a needle through mom's abdomen, and they inject potassium chloride into the baby's heart, stopping the baby's heart and leading to the death of that child. So this is, again, an outcome that can happen when ethical boundaries are not put into place surrounding IVF. Thankfully, like I said, many physicians are regulating themselves now, but it's not a requirement. And when physicians in this specialty get patients by having a high success rate, you can see how there would be a motivation to do whatever you needed to do to achieve a high success rate. Again, I know people who do it ethically and don't do that, but I think it's important for us to understand that that is happening. So not all embryos that are transferred will actually implant, and not all those that implant will survive to a live birth. Data is kind of hard to come by because there's not a lot of reporting requirements related to IVF, so we just have to go with the data that we have. But the latest data from 2021 from 2 different sources. One is an organization that is an industry organization for reproductive medicine, and the other is the CDC, showed that anywhere between 25 and 44.5% of embryos transferred survived to live births, with a higher percentage of those births being preterm or very preterm births than in non-IVF pregnancies. Pregnancies resulting from IVF also have an increased risk to both mom and baby, again, compared to non-IVF pregnancies. So for mom, she can experience when her ovaries, remember I said they get sort of hyperstimulated with those medications so that they can harvest as many eggs as possible. There is a condition that actually in its mild forms is very common called ovarian hyperstimulation syndrome. In its really severe forms, thankfully that's more rare, but it can be fatal for mom. I took care of a patient with this in residency who almost died. She was in the ICU. They can get blood clots in their lungs. They can get a huge buildup of fluid called ascites on their abdomen. So that's a risk to mom, potentially, if they're not careful with the dosage of the medication that's being used. Multifetal gestation, of course, so many having multiples. And also, as I said, a risk to babies. There's a higher risk of C-section for moms, something called placenta previa, which is where the placenta implants over the woman's cervix and can cause pretty significant bleeding if there's problems with that. And then something called preeclampsia or toxemia of pregnancy, which many of you probably heard of, high blood pressure in pregnancy. For babies, there's risks as well. There's a risk of premature delivery, which also is a risk to mom, actually, later in life. A risk of growth restriction, where baby doesn't grow as well as he or she should, and a slightly increased risk of birth defects compared to the general population. So this is quite a gauntlet that these embryos go through during the IVF process. Naturally conceived embryos go through a gauntlet as well to survive, but overall, about 90% of embryos that are created via IVF do not survive. They either die spontaneously or on their own, they're destroyed through research, they're discarded, or they're frozen and stored indefinitely. We currently have about 1 to 1.5 million frozen embryos in the US. Again, these are rough estimates. We don't actually know how many we have. And estimates are that around 12 million babies were born via IVF between the years of 1978 and 2022. So if you apply that 90% number, which is likely conservative, this means that just over 100 million human beings created via IVF have met their demise. I think that this is a sobering number, again, that we need to consider when we're thinking about this issue. And again, critically considering the loss of life via IVF in no way diminishes the value and worth of the human beings that did survive to be born. And in fact, it is that value and worth that demands of us that we consider the loss of the others. So first and foremost, I think it comes back to what are the preborn. Our church is most certainly adept in pro-life apologetics, and one of the things that I'm so thankful for actually about this church. Those same principles have to apply in our consideration of embryos created through IVF. They are just as human as you and I are. They are fellow image bearers. And again, the scientific evidence is exceedingly clear. At the moment of sperm-egg fusion, a unique human being comes into existence. Her human nature comes into existence at that exact same moment, and therefore she deserves the same rights that any other human does at that exact moment. So how then should we treat these embryos? Their humanity should not be questioned by anyone at this point. So understanding that, let's review how they are treated through the IVF process. So as the process of IVF is currently conducted, the resulting human embryos are treated as objects, as property. I'm not saying this is how their parents view them necessarily. I'm saying that this is how our culture and our laws treat them. They are treated as property both in how the IVF industry is structured as well as in our law. That's right. In most states and on a federal level, human embryos that result from IVF fall under property law, not under family law. This, I think, is a natural consequence of the manufacturing of human beings, which is fundamentally different from utilizing technology to treat a disease or improve the health of an existing human being. Objects are manufactured, and history is replete with examples of human rights abuses when people are treated as objects or property rather than the subjects they actually are. C.S. Lewis in The Abolition of Man addressed the idea of treating human beings as mere raw material. He said this: "It is in man's power to treat himself as a mere natural object and his own judgments of value as raw material for scientific manipulation to alter at will. The objection to his doing so does not lie in the fact that this point of view, like one's first day in a dissecting room, is painful and shocking till we grow used to it. The pain and the shock are at most a warning and a symptom. The real objection is that if man chooses to treat himself as raw material he will be. Not raw material to be manipulated as he fondly imagined by himself, but by mere appetite, that is mere nature in the person of his dehumanized conditioners." If anyone remembers my Body Life talk from a few years ago, I addressed the issue of whether or not we have a right to certain blessings that the Lord has deemed as good and has actually oriented us to, blessings like marriage and children. While these are both things that God has oriented us to, they are not guaranteed, and we should never think that we have a right to them. The Lord can choose to allow these blessings in our life or not. Abuses of his natural order can easily occur when we think we have a right to any blessing he might bestow. especially for something that fulfills such a deep-seated desire. We'll talk about this more in a minute, but for now, let's review abuses that are occurring that are, I think, a logical extension of this technology. So the first is the commodification of our bodies. This occurs in many ways. Surrogacy, where the womb of another woman is rented to carry someone's child. The sale of sperm and eggs to be used to create a child that the biological parent will have no relationship with is another example. This surrogacy especially often leads to the exploitation of often poor women. Women in other countries are hired to be surrogates. They become exposed to health risks then of multiple pregnancies. Again, as I said, they have a higher C-section rate. So what happens if we have a woman, I'm just picking a spot that is actually very common for this, in rural India, who, when she's pregnant as a surrogate, gets very good care because the people who have hired her as a surrogate are paying for her to get good care at a good hospital. And she has a C-section for that baby, not only because maybe she just needs one, but because they want to do everything they can to guarantee that they get a healthy baby. What happens to her when she goes back to her rural village in India and she becomes pregnant with her own child, and now she has a scarred uterus, and now she doesn't have the money to access that good health care that she had with that previous pregnancy. Now she's being put at risk and exploited. Also, the woman who carries the child does develop a bond with that child and yet has no rights at all over that child. She is merely a carrier for that child. The people who, whether they be the biological parents or not, that paid for her to be a surrogate have all the rights over that child. Now, we might think, well, yeah, they should, especially if they're the biological parents. But there have been really, really horrendous abuses of this. And again, I'm not saying it happens in every case, obviously, but this is what's been allowed. So some of you might have read, not that long ago, it's probably been within the last couple of years, about a woman who was hired by a homosexual couple to carry their child. And she found out during the pregnancy that she had cancer that was going to require her to not be pregnant anymore to be treated. Well, she very much cared about this child, wanted to give this child a chance at life. And so she said she was going to carry the child as long as she possibly could, hold off on treatment until she could deliver, at least get that baby to the point of viability. I mean, good for her, right? She was giving that child every chance at life. Well, the men who had hired her to be a surrogate said, we didn't pay for a baby who was going to be born preterm, possibly with disabilities. We don't want a child with disabilities. And so when she got to the point where she could not stay pregnant anymore, or she was going to die, she needed to deliver and get her treatment. She was somewhere between 25 and 26 weeks pregnant. She delivered, and the men who had paid her to be a surrogate demanded that no care be given to that child and allowed that child to die. And she had no say and was devastated. I read an interview with her. I mean, she was devastated because she cared for that child, wanted that child to have a chance at life, but had no rights whatsoever over what happened with that child. And this is not an uncommon scenario of homosexual male couples using surrogates to have children. But if we think of having children as something that every adult has a right to, why would we see this as wrong, right? I mean, I think this is a natural conclusion of where we've gotten by assuming that we all have rights to have a child. There are also men who have fathered hundreds of children through selling their sperm and have no relationship with them whatsoever. There's a documentary right now, I think it's on Netflix, about a man who goes actually on a cross-country trip because he has such a strong desire to have a relationship with the children that he fathered by selling his sperm. And so he's connected with over 100 of them now across the country. Other things that I think people don't think about, if you don't know exactly who fathered you biologically, you could be marrying a half-sibling and have no idea that you're marrying a half-sibling if they also were conceived using the same sperm. So there's all these ethical things that come up through essentially the selling of our bodies or parts of our bodies. Also, eugenics is something that is very much coming into play with IVF. Children are essentially being chosen for having the most favorable characteristics. And again, this is happening. This is not just conjecture. Children are chosen on the basis of their gender, their eye color, being genetically perfect. This has even led to the creation of 3-parent embryos, where you take parts from 3 different adults to create an embryo to try and select out for certain genetic conditions. So where does this end? And what happens to those humans who are deemed imperfect? Even if they are, quote unquote, imperfect in the eyes of many people, does that mean that they don't have a chance at life, or they shouldn't have a chance at life? Also, many of the testing that we do for the pre-implantation genetic diagnosis doesn't account for something called mosaicisms, which means you might have a genetic abnormality in some cells and not in others. And I'm looking at Nicole because she's going to correct me if I'm wrong. So it doesn't account for that. So what if when that child grows up, he or she is not going to exhibit any characteristics of that genetic abnormality? Again, it still wouldn't make it okay to end the life of someone who was going to exhibit that. But many parents are making these decisions based on actually incomplete information as well. The third thing is that research is being done on human beings without their consent. The surplus of embryos has created a plethora of embryos for researchers to conduct research on, specifically collecting or harvesting their embryonic stem cells. Of course, this cannot be done without destroying that human being. And just, who knows about the Tuskegee experiment? A few people, so I'll explain for those who don't. So the Tuskegee experiment started back in I believe it was the early 40s, and it took a group of several hundred African-American men who were diagnosed with syphilis and followed the course of syphilis out as they lived on. The problem is just a few years after they started that experiment, we discovered that penicillin was actually a really great treatment for syphilis and could cure people who otherwise would have died from syphilis. This treatment, however, was withheld from this entire group of men because the researchers wanted to see, well, what happens with syphilis if you don't treat it? And so it went on for 40 years before somebody blew the whistle finally, and some of the men were able to get treatment, but then, of course, several had progressed on to it can affect your nervous system, and that's permanent. Several died as well. They did not consent to that, and out of that came many stricter regulations on doing research on human beings. These embryos are not consenting to being researched on, and yet it is being done on a regular basis. And even if this research contributes significantly to our medical or scientific knowledge, the Tuskegee experiment, it contributed a lot to our medical knowledge. We found out what happens when you don't treat syphilis. However, that does not justify the abuse of human beings. And then we have all of these leftover embryos. So infertility specialists have patients seek them out, like I said, based on their success rates, and each cycle of IVF is expensive. It's not always covered by insurance. So of course they are motivated to get as many viable embryos as possible to improve the chances of a live birth. And though the numbers created per cycle, as I said, has decreased, so has the number of embryos that are being transferred at a time, meaning nearly everyone will have leftover embryos that have to either be discarded or frozen. We now have human lives that have been in limbo for over 20 years. Some of you might remember within the last couple of years, there was a child that was born who actually was frozen, I think 25 years ago. So should have been 25 plus, and now is a newborn. Unless their parents decide to give them a chance at life, or they are adopted through an embryo adoption process, which requires the consent of the biological parents currently, they will end up dying through one means or another. Many are eventually abandoned by their parents as the costs to keep them frozen become unmanageable because they have to pay an annual maintenance fee to keep their embryos frozen. So a common thread between these human beings in limbo and those that are lucky enough to survive the gauntlet of IVF and be born is that their rights and needs become secondary to those of their parents. Many children born via IVF are separated from one or both biological parents. Children naturally have a right to both of their biological parents, and there's a plethora of evidence about the harms to children when they don't have that. Of course, there are situations where it cannot be avoided, and adoption is one way of redeeming this situation. However, this is completely different from creating a human being with the intent of separating him from at least one of the two people who he has the deepest connection and right to. I think this could be a whole talk, but I will just show you guys this book, Them Before Us by Katie Faust. If you haven't heard of it or read it, I would highly, highly recommend reading this book. It's very, very good. It challenges you, it challenged me to think about this and many other issues in ways that I had never thought about it before. Not just in the case of IVF, but it challenges you to think of how often children serve to meet the needs or desires of adults, not the other way around as it was intended to be. So concluding or starting to wrap this up so we can do some Q&A, the desire to have children out of the marital union is a holy desire that was placed deep within us by our Creator. However, having children is a blessing, not a right. Though the end product of a human being created in God's image is a wonderful and blessed thing, we have to think about whether or not the means to get there are moral or immoral. The ends certainly cannot always justify the means. In her book, Conceived by Science, which I meant to bring with me and show you too, but I forgot, pro-life apologist Stephanie Gray Connors recounts the plight of single men unable to find wives in China, a situation that was created by their one-child policy that favored boys over girls. She tells of an interview she saw with a 34-year-old man who lived in a rural village and had suffered profound embarrassment due to not being able to find a wife when all his peers had married 10 years earlier. He said, "Not having found a wife yet, I feel my heart is empty. I feel like I'm invisible." His pain and suffering was deep, not unlike the anguish that many deeply faithful married couples feel at the unmet desire of having a child. This man eventually did find a wife, fulfilling his God-given desire for companionship. However, he found her through a human trafficker who sold her to him for 10,000 euros. Though he did not abuse her and he provided for her, he removed her from her rightful home without her consent and purchased her like property. Did the end of a marriage justify the means by which it was obtained? Children, again, are a blessing, and human beings created in the image of God, and regardless of the circumstances of their conception, should always be seen as such. However, not everything that results in a child is ethical or moral, or should be seen as such simply because a child results. One-night stands and sexual assault can also result in a child. Does that mean that if they do, they are morally justified? Certainly not. We must apply the same moral scrutiny to any other means of creating a child, such as assisted reproductive technology, and not simply state that it is justified purely because it results in a child. So the logical next question would be, so Christina, are you saying IVF is always unethical? I'll be honest, my own personal position, I meant to say this at the beginning because this is on YouTube, all of this represents my own personal opinions and not any organization. I'm not sure that there is an ethical way to do IVF. That's where I'm at personally. I don't expect everybody in the church to agree with me on that. I'm just being very open and honest about my bias here, that's where I'm at personally. However, I do think that if we're thinking about this critically, we could think of some things that could be done to try and make this more ethical of a process, such as only allow IVF for heterosexual married couples. Hopefully we would all be in agreement on that. No destruction or discarding of any human embryos, including for research. Requiring only single embryo transfers with fresh cycles, meaning you never freeze embryos. You create an embryo and you transfer it immediately. Prohibit all forms of pre-implantation genetic diagnosis, as this is a eugenic technique. Prohibit the use of donor eggs or sperm, although I really like Stephanie Gray Connors in her book said they're not really donors because they're making money off of it, so we should call them sperm or egg sellers. Embryo adoption should be an encouraged practice for those embryos already in existence. Again, they are in limbo. They need a chance at life. Parents must retain legal oversight and responsibility for their children, even when those children are still tiny, vulnerable embryos. Parents themselves also deserve legal protections as the guardians of their children and fully informed consent. The well-being of children is of paramount importance, and parents should retain legal recourse for negligent loss of their embryos, such as in that Alabama case, if their embryos are already frozen. We should recognize the personhood of human embryos and treat them under family law rather than as property. And surrogacy really should be prohibited. In the way that it is currently practiced, again, in the vast majority of cases, it essentially is the selling of children and often abuses the surrogate as well. Infertility is actually better addressed in a way that will not only allow a couple to conceive, but also addresses the underlying disease process that led to infertility in the first place, whether that be for the wife or the husband. Thankfully, this exists. There's something called restorative reproductive medicine that does this. It seeks to cooperate with or restore the normal physiology and anatomy of the human reproductive system. It does not employ methods that are inherently suppressive, circumventive, or destructive. It respects the integrity of the human person and the right of women and men to have access to reproductive health care that respects their right to understand and cooperatively manage their own fertility with appropriate medical assistance. This approach has actually been shown to result in conception even when IVF failed. But it also treats the underlying health condition that can improve a woman or a man's long-term health long after a pregnancy is over. So one final thing, and I promise this is the final thing. For anyone who has done IVF or supported it in some way, and after thinking about it more, maybe thinks differently about it, or maybe has some regrets, it's important for us to keep in mind that we have unimaginable grace given to us by our Father, a grace I am ever thankful for so many things in my life. This issue is tough, really tough. It touches us at the core of who we are, and so I think it can be difficult to take a deep and critical look at it. Thank you for allowing me to have the privilege of doing a brief overview of this, and I hope that, again, I don't expect everyone in this room to agree with me on every point, but what I do hope is that we can think about this maybe in a way that we haven't thought about it before. So I'm happy to try to answer any questions. I can't promise I'll have all the answers, but that you all might have, and I enjoy being challenged, so if you want to challenge me, feel free, because I enjoy having hard discussions, so thank you. We'll take Q&A. Yeah.
Say that you listen, we have somebody who's considering this, and we want to put some resources in their hands. You mentioned this book, we'll have this YouTube video, but is there something else that we could direct somebody to that has this kind of information that isn't too technical, but could help a couple navigate this?
Yeah, absolutely. So for additional resources, honestly, the two books that I talked about, I think are the most excellent resources I've read, from, like looking at it from the ethical perspective. So Them Before Us by Katie Faust and Conceived by Science by Stephanie Gray Connors. And I listened to Stephanie on a podcast recently, and she is Catholic. And so, of course, there are Catholic theology that plays into how they consider IVF, but she actually said that she specifically wrote the book for non-Catholics. So not bringing the Catholic theological perspective into it, but looking at it from a bioethical perspective outside of that. Also, APLOG is working on, but as you can imagine, even within our own leadership, we're working out things of, what our statement is going to be, but we will soon be putting out a document on the ethical treatment of human embryos, both in research and through assisted reproductive technology. We hope to have that out by mid-fall, and I certainly can share it with you. Maybe we can share it with the church when it's out. So that would be looking at it more from a scientific and medical perspective, and how we should be thinking about how these embryos are treated. Yeah. Mm-hmm.
The determining aspect of that, is that before undifferentiation or post undifferentiation, where the cells are actually starting to, like, if you will, have a name tag saying, I'm a bone cell, I'm a blood cell?
Sure. So typically it's going to be either before that or at the very earliest stages of that. So it's when it's still in the blastocyst stage. So, you have multiple cells, but they haven't fully differentiated, which is why these embryos actually serve as, a good source for researchers, right? Good in quotes, obviously, but for researchers, because they can harvest so many stem cells that they can induce to differentiate in whatever way they want to. So, yeah.
So blastocyst.
Yeah, so in the blastocyst stage is when that's done.
Forgive me, but this seems like IVF, the whole concept, to me, has always been more of like a last resort type of thing. And then talking about this, it seems like this is more like designer baby, where it's like, oh, we can conceive normally, but we want our baby to have this aspect.
So maybe that's done by some, again, there's no rules or regulations to say somebody couldn't do that, right? So maybe that's done, but I think you hit on another point too, in that I think maybe many people would see this as a kind of a quote unquote last resort, like when all else has failed, but that actually is not how it is in practice now. So many times if people go to see an infertility specialist, unless there is a really easy fix prior to that, like maybe they can just do intrauterine insemination or something like that, and the woman gets pregnant, they oftentimes are shuttled very quickly to IVF. Because again, it's a workaround. So you don't have to fix the underlying problem, you just go around it and you do IVF. If there were no ethical problems with IVF at all, then maybe that would be okay. But again, there are conditions that can lead to infertility that actually have long-lasting health implications for women. And so if you're not doing anything to treat that, then you're actually, I think, doing the patient a disservice because you're not actually addressing that underlying health condition. You're addressing symptoms, exactly, but not actually addressing the disease itself. So, yeah. For some, right. And again, just making the point too, and then Nate, and then I'll go with you, that what I'm saying doesn't mean that every couple who goes through IVF does these things. I think we just need to consider about what is allowed under this industry because of the lack of regulation and because with like many things with scientific and medical technology, oftentimes the people advancing it are just thinking about whether or not they can do it, not whether or not they should do it. And the boundaries keep getting pushed and pushed and pushed. So there used to be a 7-day embryo limit for research. So you could not grow an embryo outside of a woman beyond 7 days in order to be, well, what if we got it to 14 days? Then maybe some of those cells have started to differentiate. Then we can do research on that. No, it was a hard cutoff at 7 days because that's when embryos would be transferred. Now that has been pushed out to 14 days. And now there are people that are really, really pushing for that to be pushed even further. So as you can see, I mean, this is not unusual with medical technology, right? When we don't have ethical guidelines around it, is that you just keep pushing the boundaries. So yeah, Nate.
Technology that doesn't necessarily, the implantation and success rate is low. You have multiple zygotes being created, all those sort of things. And so in the last part of the talk, you were talking about, well, how, if we mitigated those, like if we, under ideal circumstances, if we just did one embryo, if we did it between heterosexual married couples, all those sort of things. So, and you probably already answered this with your last bit, but is there a scenario that you can think of where all of those pieces fall into place and the technology gets good enough where the success rate is a lot higher? Do you see a scenario down the road where IVF is a redeemed process or a way that, is there a way that you can actually do it if everything were ideally happening?
Leave it to you to ask me the hardest question. No, I have an answer for it. Again, not everybody has to agree with me on this. Oh, sure, yeah, for the people listening online. Yes, so Nate asked the question that if the things that I listed towards the end that we could potentially put into place to mitigate the ethical problems with IVF, and we get our success rates up, and it's done between a heterosexual married couple, and we don't freeze any embryos, things like that. Could I foresee a way then that this could be done in an ethical way? I think there's two responses I would have to that. One is, simply thinking about it from an ethical standpoint, and then the other, again, would bring in some theology, and to be fully honest, like I'm still hashing through that a little bit in my own mind. From an ethical standpoint, so first of all, if we are going to improve our technology to improve our success rates, what does that mean? That means that we're continuing to create human lives that are going to be lost, and we know are going to be lost in the process. So if it takes us 50 years and we get up to a 95% success rate, does that justify the loss of all that human life to get up to that success rate? I personally don't think that it does. The other thing is we know that IVF-created embryos are less likely to survive, right now. So even if you're doing that single embryo transfer, fresh transfer only, not freezing any embryos, you're still creating a human life that has a lower chance of surviving. And even if that child does survive, you've now put mom at higher risk of pregnancy complications, you put baby at higher risk of pregnancy complications. And maybe this is too strong of a statement. If somebody takes issue with it, that's totally fine. I think that saying, well, we see complications though in naturally conceived pregnancies as well, and you see natural loss with pregnancy, I agree with that, but I think making that equivocation would be similar, maybe not exactly the same, but would be similar to people who say that induced abortion is merely just mimicking a miscarriage that naturally happens. Those are very different. Induced abortion, you made it happen. Miscarriage, it happened on its own with no intervention from us. So that's where I'm at. Again, somebody can take issue with that, and that's okay. But so that's, I think from the ethical standpoint, that's how I would look at that. On the theology side of things too, and again, the Stephanie Gray Connors book, one of the quotes that she said in there was that procreation is a communion of persons. And so whether that be the husband and the wife or the mother and the child, and that IVF actually divides relationships and introduces a third party who has no connection to that child, who is intimately involved with the creation of that life. And so, and again, this is something I'm still working through in my mind, so I'm not, this is why I want Wendell or Josh to do a sermon on this, because I'm still working through it in my mind and figuring out where I stand with that, but that really resonated with me, and I thought, maybe I need to think about it in that way, you know what I mean? So again, I'm not saying that that should be everybody's perspective. That was just something that resonated with me of what she said that is getting me to now start thinking about that aspect of it in a deeper way that I've never thought about it before. And I don't know where I'll land on that. I mean, that's just kind of where I'm at right now. So, yeah. Yeah. So for each cycle, those numbers that I quoted, the 20, anywhere between 25, again, it's really hard because there's no reporting requirements at all. So it's all voluntary reporting of success rates and how many they transferred. But it would likely be, you know, fresh embryos should have a higher rate of implantation, so it'd probably be closer to that 44% than to the 25% success rate. So,
That end up being viable pregnancies that
right,
result in a child being born.
right,
25 to 44%.
right. And I would guess, I don't have actual data to base this on, but fresh embryos do have a higher implantation rate than frozen that have been thawed. And so my guess is that the success rate, if you were only doing single embryo fresh transfers, would be closer to that 44% number than to the 25. Yeah, Josh.
I want to start by saying I agree with your position, so I'm not, but I'm just curious to get your thoughts on, I could foresee a potential response being, you know, to the hypothetical single embryo, single cycle, still having a lower success rate than natural pregnancy. I could see someone asking, we also have situations where you have a couple with, who are, say, known carriers for a condition such that their chance of a successful pregnancy in the event of natural conception is significantly lower.
Sure.
Would you say that in addition to the things you mentioned, the involvement of a third party, the fact that we're going outside sort of the natural process, would you see any other relevant moral distinctions that would distinguish between those scenarios?
Yeah, no, I thank you for asking that question because I think it is a really good question. So for those listening online, Josh asked about, you know, what about couples that maybe are carriers for a condition, or maybe mom's a carrier of a condition like a blood clotting disorder that predisposes her to have miscarriages. And so anytime they conceive naturally, they're going to have a higher rate of pregnancy loss than somebody who doesn't have that condition. And I think that is a valid point. And honestly, I've taken care of couples who were in that situation who were having serious discussions of, do we even try to conceive anymore? Because we know there's such a high rate of loss. But I would still say that that's different, because in the act of intercourse, you are not actually the ones making conception happen, right? You're setting up a scenario in which it could happen. And then you are allowing the natural course of events to take place. And maybe you conceive and maybe you don't. Versus, again, doing direct intervention to create a human life that you know has a higher rate of loss. So that would be my response to that. The other thing, too, that I wanted to mention earlier and neglected to is, you know, I sort of throw out that pre-implantation genetic diagnosis is very bad. I think that it is. I think it is very eugenic. However, I have talked with some deeply faithful Jewish people who they have a very high rate of devastating genetic disorders. And they view it, I don't agree with their position, but they view doing that as not bringing a child into the world who they know is going to have profound suffering. Again, you could use that same argument to apply it to abortion, right? But I just say that to say I don't discount the deep thought process that many people go through surrounding this issue. And so I just thought that I should bring that up to say that, I get it. And if you've raised 4 children that had that disorder and it was really hard on you, like, again, I'm not saying that I agree with their position, but I can see how your mind would go there and you would think in those terms. So, yeah. I think I saw you first and then Ben, yeah. Mm-hmm.
And you talked about adoption of these embryos.
Mm-hmm.
Wonderful, wonderful idea. How does that work, though, as far as we have guidelines for the adoption of children who are already born?
Mm-hmm.
How does that work for the unborn, for these children who are frozen embryos?
Yeah. Yeah, yeah.
And it's like a mess right now because there's so many frozen embryos and what happens. And also ethically, how does that work? Ethically and theologically, who has that right to become a parent that way?
Yeah.
Or to, it gets very confusing.
Yeah.
We talked about that marriage and parenthood is a blessing, not a right.
Right.
You're wanting to rescue these frozen embryos, and I thought about this. I thought, oh my goodness, do you encourage people, your own children, do you encourage people, let's get these frozen embryos implanted in,
Yeah.
It's a very slippery slope.
Yeah. No, I fully agree with you. So the question is about all the frozen embryos we have in the embryo adoption process and what does that look like? Is it ethical? And and I know that there are people in this room that have experience with this. So if I say anything wrong, please correct me. So no, it did. Yeah, no, it made total sense. So one of the concerns that I've heard with the embryo adoption process is, are you creating an industry essentially? Like, are you creating a demand for leftover embryos so that people can adopt them? I would say with a surplus of 1.5 million embryos, we are not creating an industry. And I think you can pair that with regulations that would say you can't freeze embryos anymore, so then we're not creating any more that are frozen, but we're taking care of the 1.5 million that we have. I think from an ethical standpoint, we should view that the same as we would any adoption, that we as believers are called to care for the orphans. These are children who are orphaned. Many have been abandoned by their parents, like I said. And I was speaking at a policy conference recently where one of the policies that I brought up is, and I said, I'm not a lawmaker, I don't know how this would work, but we have laws about born children where if they're abandoned by their parents and they meet certain criteria, their parental rights are terminated, they become wards of the state, they then are available to be adopted. Could we do the same thing with embryos for all these embryos that are in limbo that have essentially been abandoned by their parents? Could we say that these need to now be able to be adopted? I think it's a policy to consider personally. So I think parents who are going to do embryo adoption, I believe, have to go through the same home study process, all of that adopting a born child you would have to go through. It's important to note that people creating children through IVF do not have to go through that same process. So, and that leads to, again, I'm not applying this across the board, but some of you may have seen recently, there was 2 different instances in the news of men who were pedophiles who said that they explicitly had children created and carried by surrogates so that they could abuse those children after they were born. It is sick. And they don't go through the same screening process. Again, I'm not saying that applies to all IVF, but that can be the consequence when you don't go through a screening process. So parents who are going to adopt embryos go through the same, home study, screening process, all of that. It is obviously a little bit more risky for the woman of the couple who's going to carry them because she has to also go through hormone injections and things like that to get her body ready to accept the embryo. I think for a consenting adult, yes, if mom is willing to take on that risk of of, you know, the potential risk of the hormone injection so that she can give this child a chance at life, then yes. I mean, because I think if you look at what's the alternative, right? That these children die or they live in limbo forever. So, yeah, I personally think that it's a wonderful thing. I think for many people too, it gives women who otherwise maybe don't have the chance to carry a baby inside of them and then, you know, breastfeed that baby and things like that, that you don't necessarily get with more what quote unquote traditional adoptions. It gives women a chance for that as well. But ultimately, again, our focus on this embryo adoption should be about the children's rights, not about the parents' needs or the parents' rights or anything like that. It needs to be about the rights of those children to have a chance at life.
So as a church body and as a, if we have a friend
Mm-hmm.
who's struggling, her and her husband are struggling with infertility, this could be a viable option to bring up, to say, you may want to look into this because there are so many frozen embryos out there.
Right. Right. Yeah, absolutely. And there's a couple different, there's the National Embryo Adoption Center, which is run by someone that works with APLOG quite frequently and is very pro-life. Also, Nightlight, right? Has a snowflake, they call it their snowflake adoption process, which is embryo adoption. So those are the two that I'm aware of, and there might be others that are doing it as well. So.
I wanted to tell you, I really appreciate the way that you, in a loving and professional way, address this
Oh, thank you.
because you did a wonderful job.
Thank you. Now I'm going to ask for an easier topic next. Do we need to cut it off? Okay. Okay. All right. I can talk to you afterwards, Ben. Okay. Okay.